We actually have cosmetic surgeon Dr. Jan Trokel backstage right now. He's about to give a little pick-me-up to a patient of his. She has a problem with her appearance. So, Dr. Trokel, tell us what you're going to do.
We're going to do my Y eye procedure, and what that does, it's going to rejuvenate those old, tired-looking eyes, all without surgery.
Dr. Trokel, you're going to go ahead and start this procedure now. This is a pretty quick, about 15-minute procedure, right?
Well, this is a procedure that's going to take about 5 to 10 minutes per side, and you're going to see we're going to finish this up real quick, and she's going to have a beautiful result, all without any scars, no bruising, no swelling.
Wow.
Nice.
Yeah, it's cool. He's actually doing a lifting procedure, all with an injection technique.
And you, as a plastic surgeon, often talk about less invasive is always preferable.
Well, yeah, and we know the part of aging that why do things fall in response to gravity? It's part of the reason is we lose volume. So by adding volume back to certain places in the face, you will lift the face and get a similar result to what you would get making a cut and either tightening things, removing skin, that kind of thing.
And I know everyone is gasping a little bit. Obviously, Ingrid is completely anesthetized. She can't feel any of that.
What we're going to do is we're going to actually start lifting the entire eye complex from the forehead all the way down. Now, when we think about eyes, there are really two kinds of eyes, and this procedure actually takes care of both types of eyes. For patients that have, like, almond-shaped small eyes, as we age, just like you said, Dr. Orton, aging is a process of volume loss. It just shrinks. So almond-type eyes, guess what happens to those? They just drop down, and it looks like we have excess skin. But for big eyes, for example, like mine, or like Ingrid's, as we lose that volume, we look more sunken. We don't look like we have extra skin, but we look more sunken. And by replenishing that beautiful volume, we're going to give back those beautiful, pouty, sensual eyes that we had when we were like 30 years old.
So, Dr. Trokel, you're going to finish that procedure. I know our audience, I think we're going to go ahead and move on. The audience is, we're going to let everyone in the audience take a few deep breaths.
What are you talking about? That's looking beautiful.
Is everyone okay?
No.
I just want to make sure.
Barely.
I've seen some pale faces out there. So, Dr. Trokel, we'll let you continue. We're going to have the results just a little bit later in the show. At the top of the show, we were just beginning a 15-minute eye lift procedure with Dr. Trokel and Ingrid. He's all finished. You excited to see her new look?
Yeah.
I know I am, because I want to remind everyone really quickly of Ingrid's before picture. And this is literally 15, 20 minutes ago. This is Ingrid now. Very impressive result, if I may say so myself.
Wow. And Dr. Trokel, you did that in literally how many minutes?
I got to tell you, it was a little bit of a fib. It's not a 15-minute. It's really a 6-minute. It takes 3 minutes per side. Now, when I do the eye, I actually treat the whole brow. I treat the temple. I also treat a little bit of the under area because the whole complex will get rejuvenated. So when you do that...
Your eyes come out further, don't look so sunken.
Exactly, and that's what happens.
Excellent.
And we touched on a little bit in the first segment that we know that part of aging is losing volume. Part of it is the gravitational forces, things falling. But in this case, because you're still very young,
now you're 35.
And I looked at her before you started. I don't think she was a surgical candidate.
And I'll tell you, this procedure here that we did will typically last anywhere from 2 to 4 years.
I love your cheeks. It's beautiful.
Well, that's part of the...
Are you ready to make your
I know what she's thinking right here, young lady.
Most important of all, Ingrid, what do you think?
I think it looks great. And
100%.
really, and honestly, it really didn't hurt. Not at all.
You certainly look great.
Thank you.
Really quickly, for people at home watching, who is and isn't a candidate?
For people like me, big eyes, round eyes, for all of us that have those nice round doll eyes, this is the perfect procedure because you really don't get excess skin. So you lift the brow a little bit, you fill the under eye, you don't see the eye sockets anymore, and it just brings out that sensual, smoky eye look that we had when we were 20.
Well, thank you so much, Dr. Trokel. Thank you, Ingrid.